Welcome back. I am Calypso Queen, and this is a monologue of a healthcare worker. I wanted to talk about a couple of different topics today. But first and foremost, I have been gone for a few days, and I'm back now. Thank you for your patience. My day ones, thank you so much for your patience and waiting for these videos to come out. I have been struggling a little bit. I'm gonna be transparent with you guys. It is the birthday eve for my mom. Her birthday is on the 12th, and I just been having a little bit of a hard time. She is gone. She passed on and went on to glory. Um, it'll be about 5 years now, and it doesn't feel like 5 years. Okay, you guys. So, every year around her birthday, I get a little bit emotional. Well, a lot of it emotional. Um, but I just wanted to let you know that my head has kind of not been in the game lately. So I'm back, and I want to talk about a few different subjects today. One of them, first and foremost, I am a hardworking healthcare worker, a CNA to be exact. Everything I'm going to be talking about is strictly my opinion for entertainment purposes only. Um, so, one of the topics I wanted to talk about was hospice. I want to talk about hospice. Okay, a lot of people may be under the impression that hospice is just this death sentence for a, a family member. Okay, for some cases it is, and for some cases it's not. Okay, as soon as someone hears the word hospice, a lot of people assume that their family member is just going to pass away. That's not always the case. I've had patients who have been on hospice for years, okay, and it's case by case, okay. It's not like that for everyone. Not everyone is just going to die a month after being on hospice, okay. I've had patients who are on hospice who've lived for years, 3, 4, 5, 7 years, like, so when you hear the word hospice, I want you to think comfort care measures. That is what this is about. It's about comfort care measures. It's not flat out saying that your family member's gonna die. Okay? Not for every case. And even if that is the case, then you want them to be the most comfortable, right? You don't want them to be in pain. You don't want them to be suffering. You want them to have that extra care that maybe the facility can't provide. So, if a nurse or a doctor is calling you and they're specifically asking you, do you want to start hospice care for this family member? It is not saying, oh, your family member, they're down spiraling, they're just going to die. That is not what they're saying. They're saying, do you want to provide comfort care measures, extra care for this loved one so that they are not, one, in pain, two, uncomfortable? Because sometimes, in the nursing home setting, we give the best care that we can give. Okay, I'm not going to lie. We give the best care that we can give. We are not always fully staffed, but hospice care will allow them to get the care that they need when they need it. It's just to keep them comfortable, until the time comes. It's not saying that they're gonna die tomorrow. It's not gonna say they're gonna die a month from now. It's just to say, hey, I think this person may need comfort care measures. Okay, so the reason I want to talk about this is because I had a resident a while ago who, she was actively passing, but it didn't start off that way. She was very active. She was doing things for herself and things like that. And then when the conversation of hospice came up, the family, they initially agreed, okay? And then when the day came to actually sign the paperwork, they changed their mind. Now, I get you having a moment of denial, where you're like, okay, she's gonna come out of it, this and that. But here's the thing: if we are telling you she may need comfort care measures, use common sense and say, okay, they see her every day, they work with her every day. This may be something I actually need to do. Instead of being in denial and saying, oh no, we're just not going to do it. Because then you're making a decision for your loved one to suffer, as they're passing or before they pass. You're making a decision for how they're going to pass. And in a lot of cases, if the person is not on hospice, not every case, but in a lot of cases, if the patient is not on hospice, it's a painful death, okay? And you don't want that, especially, if they're DNRs. You want them to die comfortably, peacefully. You don't want them to die in a whole bunch of pain. You don't want them to pass in a whole bunch of pain, if I can't say the word DIE. So here's the thing. Um, that's just kind of, I guess, all in all, what I wanted to say about that. The other topic I wanted to talk about, let's get into it, all right? I want to talk about working with newbie CNAs. Newbie CNAs. Okay, this is for my seasoned CNAs. Seasoned, we seasoned. We know what we're doing. We know what we're talking about. We know, we know, we know. Right? Here, stop yourself. Because that's great. It's lovely. It is lovely. But you have to be willing to teach. You have to be willing to show. You have to be willing to have a little bit of patience with these baby CNAs, because remember, you started out as a baby CNA too. You weren't always as seasoned as you were. You asked questions. You didn't know, just, what you were doing. Practice makes perfect. Let's just be real. I started out somewhere too, okay? But not every baby CNA is the same. That's the first thing you learn. A while ago, I worked with a baby CNA, and it was, actually, I'm going to reference two of them. One of them, she was very innocent and doe-eyed, and very cute. And it's the ones like that that I love, because you can mold them into good CNAs. Um, when they start off with like, can I ask you a dumb question? I'm like, oh no, honey, no question is ever dumb. There is no dumb question. If you have a question, ask it, please, because that's the only way you learn. And then you have the other ones who complain about everything, complain about the set, complain about the residents, complain about what floor they're on, complain about their schedule, complain. Do I get a break? When do I go to break? Oh my God, I don't want to work this shift. I don't want to be on this floor. How many of these residents do for themselves? Oh my God. The whole shift. Okay. And then want to complain about whether or not, if they had 3 showers, it's an issue. No, honey, this is nursing. This is what you signed up for. I need you to get a thicker skin when it comes to this kind of stuff, because you're going to deal with this every day. You do what you can do and you keep it moving. And that's the advice that I gave her. So, to those baby CNAs who maybe don't understand the full scope of what they got themselves into, humble yourself and get a thick skin and learn. This is nursing 101. You signed up for this to take care of people and not to do it complaining, but be compassionate about it. And if you find that you can't be compassionate about it, get out of the nursing home field. Get out of the nursing field, okay? If you cannot do your job and be compassionate and understanding, I understand sometimes they're going to piss you off, okay? It happens. You're only human. But you still need to be able to compose yourself and do the job effectively. All right? This is nursing. This is what you signed up for. So stop whining and learn how to do the job to the best of your abilities. All right? That's that. I had to get that off my chest. But Anyways, I'm Calypso Queen, and this is the inner monologue of a healthcare worker. Stay tuned.